Consumers today can choose from an almost unlimited variety of poultry meat and egg products. These products are abundant, nutritious, safe, and very affordable. Decades of scientific research have enabled the poultry industry to implement practices which allow the birds to thrive in a productive and comfortable environment. Consumers today are very curious about how their food is produced and want to know more about specific issues. One topic discussed often today is antibiotic use. US Poultry has invited two noted experts to help us understand the use of antibiotics in the poultry industry. Dr. Randy Singer and Dr. Chuck Hofacre will answer questions concerning current and future use of antibiotics in poultry.
Hi, I'm Chuck Hofacre. I'm a veterinarian and I've specialized in poultry medicine for the last 30 years. I'm a professor at the University of Georgia and I teach veterinarians the specialty of poultry veterinary medicine. Today we're going to visit this farm and talk about antibiotic use and antibiotic resistance in the poultry industry. One of the major tools that a poultry veterinarian and the poultry industry uses in their fight against diseases is to prevent the disease to come onto the farm in the first place. So before we go onto this farm and talk about antibiotic resistance and antibiotic use, we'll be putting on boots and coveralls and a hairnet so that we don't bring any diseases onto this farm.
How is the decision made to treat with antibiotics?
A chicken will show quite a few different signs if they have become sick. For example, there'll be swelling around their eyes, or there may be a nasal discharge, or they'll have a cough. And whenever they do get sick, then the farmer who has been trained to look for those different signs will then call the producer and his flock supervisor, who is a person that comes to the farm several times every week, will then come and look at the birds. So when a flock of chickens is sick, a veterinarian or a representative of the poultry producer, who's called a flock supervisor, will go to the farm, examine the birds, and if necessary, if an animal has died, then they'll do a necropsy, which is an animal autopsy. And at that autopsy, that necropsy, they may take a sample and take a swab culture of the affected area so that we know what bacteria is causing the disease. We know that by doing that, we can specifically hone in on the correct antibiotic for that infection in that flock of chickens. So we bring the swab back to the laboratory and we'll streak that swab on this auger plate, and in each of these discs is impregnated with an antibiotic at the approved use level. And if the bacteria that's causing the infection in the chickens is susceptible to that antibiotic, it'll create this zone of inhibition, or it'll keep the bacteria from growing in that area where the antibiotic is permeating out into the auger. And that's how we know which antibiotic to choose that's the most appropriate for preventing any further disease. All of the antibiotics approved for use in the United States require information on the length of time that you can use that antibiotic, and then you have to stop before the birds can go to the processing plant. And that's called the withdrawal time. That's the length of time so that we don't have any antibiotic residue in the meat. So when you buy chicken in the grocery store, you can be assured that there is no antibiotic in that meat, even if there might have been an illness in that flock.
This video was brought to you by US Poultry and Egg Association. Funding for this video was provided by the International Poultry Expo. Please support our exhibitors.